Hi, I am Dr. Kalanidhi Veeraswamy, plastic and general surgeon. Today I would like to talk about cholecystitis. Today cholecystitis is a fairly common problem in general surgical procedures, and patients undergo a procedure called as laparoscopic cholecystectomy. So gallbladder is an organ which is there in the undersurface of the liver, and the function of the gallbladder is to accumulate bile, and whenever we eat, invariably there will be some fat in the meal, and this fat is digested by the bile, which is pumped out by the gallbladder into the duodenum, that is just after the stomach. That is the first portion of the small bowel. So the food mixes with this bile, and the fat in the food is digested by this bile and it's absorbed by the rest of the intestine. So the gallbladder has developed some stones when there is an excess production of bilirubin. So the different stones are forming, which is bilirubin stones or cholesterol stones or mixed stones. So once these stones are formed, these can cause pain. So this pain can lead to a lot of discomfort for the patient, and once this kind of a problem is identified, the decision to operate is based on the number of stones, the size of the stone. If it's a very large stone, it can slip through the gallbladder from the cystic duct into the passage where the bile and the pancreatic juices are being secreted into the small bowel. So this pain can be very severe, and once the stone comes and lodges in this, it can cause obstructive jaundice. And similarly, if there are multiple stones, it is better to operate. And if the patient is a diabetic, these patients may not feel the pain, and even if there is some infection which is getting worsened, only in the late stages it will be manifest. So these are the indications where surgery is advised. And once surgery is decided upon, the diagnosis is confirmed by taking a CT scan and an MRCP, that is, it is called as a magnetic resonance cholangiopancreatogram, to make sure that there is no stones within the bile duct before the surgery, so that we are confirmed that after the surgery that there will be no stones in the bile duct. And blood tests and X-ray and ECG for the anesthesia purposes. And this procedure is nowadays commonly done by laparoscopic surgery. So it's called as laparoscopic cholecystectomy. And laparoscopic cholecystectomy is a boon for the patients, because prior to the advent of laparoscopic cholecystectomy, the surgery had to be done by an incision on the undersurface of the rib cage, and hospitalization was for anything between 5 days to 10 days, and patients getting back to normal took about a month or longer. But with laparoscopic cholecystectomy, there are only about 3 or 4 holes which are made, one in the umbilicus and 3 under the rib cage, in the midline and in the center of the right axillary region and the mid-clavicular line. So once the surgery, it may take anything between half an hour to 1.5 hours, depending on the adhesions or problems faced during surgery. And once the surgery is over, the patient is able to get up and walk after a few hours immediately after the surgery. And the patient can be back to normal the next day itself and get back to work within, say, about 3 or 4 days' time. The cost of laparoscopic cholecystectomy varies between hospitals based on the infrastructure they have. Though the surgery can be done safely and effectively in any hospital, in hospitals like our VEECARE hospital, the cost will be anything between 60 to 70,000 rupees, provided there are no other incidences where the patient is staying for a longer time. And the same thing in a corporate hospital can cost anything between 1.5 lakhs to even 2 lakhs.